So good morning. We're going to get started with the formal announcement. I want to introduce the people who are sitting here this morning. We have MLA Derek Mumberket, MLA Jeff McClellan, the Chief Executive Officer of the Nova Scotia Health Authority, Janet Knox. We have Dr. Paul MacDonald, Department Head for Internal Medicine for Eastern Zone, Premier Stephen McNeil, and Health and Wellness Minister Randy Delory. So, Minister Mumberket.
Good morning, everyone. I'm Derek Mumberket, the MLA here in Sydney. I would like to welcome everybody here today to a significant investment in this community. This community has spoken to me and to others about the direction of healthcare and the investments that are needed. And I'm very honored to be here today as a local MLA to be here with my colleague Jeff and the Premier and all staff with the NSHA to make some very significant investments in healthcare in this community. So at this point, I'd like to pass the microphone to my colleague, Jeff McClellan. Thank you.
Won't even answer calls from people. Hang your head.
Thanks, Derek, and good morning, everyone. Look, healthcare is a priority for Cape Breton. We hear it every day that healthcare is what matters the most to Cape Bretoners. Every day in our offices, Derek and I, elected colleagues of all stripes and of all levels. So today is about making an investment and changing the landscape for us in Cape Breton and across Nova Scotia. Folks, we're demanding changes in healthcare. We're demanding that fixes come and the status quo isn't working. That's what we hear loud and clear. And today's announcement, it's a big one. It's a huge investment. It takes a lot of courage, and it's good news. And if you hear the details and understand the long-term plan, this is good for us. So I know Derek and I, our role as representatives at the government table, at the cabinet table, this is about the future of healthcare for all of us, ladies and gentlemen. So I am happy to be here with Derek, with the Premier, my friend Stephen McNeil. We're gonna, folks, hang in with us and let us do this. This is going to happen, and it's going to be a positive thing. I also want to recognize there's a number of health professionals here. Dr. McDonald's on stage, and the many others who are here. They've worked hard, and they've worked to keep this all together. And we know that they want changes as well. So, and also the Nova Scotia Health Authority is going to be a big part of this change and making sure we get the details right so that we have a better healthcare delivery plan here in Cape Breton. And with that, I'd like to invite the President and CEO of the Nova Scotia Health Authority, Janet Knox, to say a few words.
Thank you, Minister McClellan. And thanks to all of you for joining us today, including those from across Cape Breton and the province who are viewing this online. This is an important day for all of us who share a vision for a healthier province, a healthier Nova Scotia. We're here today to announce a significant redevelopment project for Cape Breton, one that will help ensure a strong, reliable health system today and for our future generations. What changes are we talking about? We'd like to show you. We have a video here I'd like to show you.
It is time for a revitalized health system in Cape Breton, one that will meet the needs of patients, families, and their communities, today and into the future. CBRM has 4 hospitals within 30 minutes of each other. These facilities have served their communities well for many years. But our buildings are aging, our health needs are changing, and our workforce is changing too. We need to ensure the way we deliver care and services reflects the needs of today. There is an opportunity to work together to provide quality services in our communities and our facilities today and for future generations. Cape Breton Regional is an important part of this. It is the second largest acute care facility in Nova Scotia, a regional referral and trauma center. It's also an important teaching hospital, and it will do even more. There will be a significant redevelopment and expansion of its emergency department and its cancer center. The Glace Bay Hospital will also expand with a renovated and revitalized emergency department. Both hospitals will take on more surgeries, hospital beds, and emergency care will all move from New Waterford Consolidated and Northside General to Glace Bay and the Regional. The New Waterford Consolidated and Northside General hospitals are aging and simply can't be expanded or repurposed. New modern community health centers will take their place, offering many of the same services they do now, like day clinics, blood collection, and x-rays. They will also be home to community-based health services like mental health and addictions, and collaborative primary healthcare teams made up of doctors, nurses, and other health professionals. New long-term care facilities will also be built in New Waterford and North Sydney. Each complex will have about 48 beds. As part of this transformation, Emergency Health Services will launch a new community-based paramedic program to serve CBRM. Paramedics will care for people in their homes, reducing the number of unnecessary trips to emergency departments. Our EHS team provides the best care in the country, and we want to take advantage of that expertise. This is Connected Care, providing people in Cape Breton with a revitalized health system they can rely on today, and one that will be there for future generations.
The health, well-being, and quality of care for the individuals, families, and communities we serve are at the heart of this entire plan. With our health needs changing and our buildings aging, we have an opportunity to redesign our programs and services to better meet the needs of our communities now and into the future. Our goal with this project is for the people of Cape Breton to receive the right care at the right time in the right place. There's no secret about the health challenges we face. Nova Scotia has an aging population. We have high rates of chronic disease. We have recruitment challenges. We have aging infrastructure, to name just a few. Access to health care is a key concern for Cape Bretoners, as it is for many Nova Scotians. We know residents want more reliable emergency care, and the closures at New Waterford Consolidated and Northside General Hospital are confusing and frustrating. We also understand the need for more long-term care beds and better access to primary care and to doctors. The challenges we face, including the changing health needs of Nova Scotians, tell us that simply reproducing what exists today is not the answer to meet our future needs. We need a new, future-focused model of care and service delivery, one that reflects advances in technology, best practices, and most importantly, the diverse needs of our population. That is what this redevelopment is about. As a system, we need to be more strategic in the way we plan, fund, and deliver our programs and services so that we can ensure providers, programs, and facilities operate as one integrated system to serve Nova Scotians well. The work ahead of us involves a number of different locations, some small changes, some big ones, some major renovations, and some new construction. So in summary, we will renovate and expand the emergency departments at Glace Bay Hospital and Cape Breton Regional Hospital. We will improve space for delivery of specialty services like critical care and expand the Cancer Centre at Cape Breton Regional. These are important services for people across Cape Breton, Island, Antigonish, and Guysborough counties. We will build 2 new community health centres, one in New Waterford and one in North Sydney. These centres will replace the aging New Waterford and Northside General hospitals. They will offer many of the same services that are available today, including community-based services such as mental health and addictions, day clinics, and support services such as blood collection and x-rays. They will also offer comprehensive primary care. We will be working with physicians, staff, and community partners to develop a model that meets the needs of the community. Surgeries and emergency services will gradually move from New Waterford Consolidated and Northside General to Glace Bay and to Cape Breton Regional Hospital. Hospital beds will also be moved to the Glace Bay Hospital, Cape Breton Regional Hospital, and/or Harbourview. Emergency Health Services will establish a community-based paramedic program in the region modeled after the successful extended care paramedic program that has been in existence for several years in Halifax. A new long-term care facility will be built in New Waterford and in North Sydney. These facilities will have an estimated 48 beds, adding about 50 new beds to the system. These changes and others, as we plan together, will allow us to make the best use of space and all of our resources to deliver the right care in the right place at the right time. These improvements will create an attractive modern work environment for our hardworking health professionals, support our efforts to recruit additional providers, and provide a welcoming, accessible space for our patients. As we look to the future, I want to thank our employees, physicians, volunteers, and learners for the exceptional work that they do every day. We hear again from many times from our patients and families the importance of quality of care. I want to acknowledge the generous support of foundations and auxiliaries who also help us provide that high-quality care and ongoing support and contribution of many of our partners, many who are in this room right now. I understand people will have many questions about this project as we move forward and will be interested in ongoing information. There will be a website that's up. We invite you to visit it, CBRM. healthredevelopment.ca, CBRM healthredevelopment.ca. So we will make sure that there are regular updates there, and moving forward we will create opportunities for people to learn more about the project. Together we are focused on building a safe, high-quality health system to support Nova Scotians to be healthy and stay healthy. This project is our opportunity to ensure the people in Cape Breton have a strong, reliable health system today and for the generations to come. Thank you all for being here today, and it's my pleasure to introduce my colleague, Dr. Paul McDonald, who's our Department Head for Internal Medicine.
Thanks, Janet. Well, what an engaging audience. There. So, hi, I'm Paul McDonald. I'm a cardiologist who's been working in your community and serving the patients of Cape Breton for over 20 years. Thank you. And I have colleagues who are here. I have colleagues. There's a huge team involved in doing a good job. Healthcare, even Donald Trump recognizes healthcare as complicated. It's really complicated. It's hard work. It's difficult. It's scientific. It's highly technical. And there's a lot of changes going on in healthcare. And so even the building that I work in the regional hospital, which is relatively new, is out of date for some things that we should be doing to provide the best care to our patients. And so I'm excited about this announcement today. About 4 years ago, a number of my colleagues and I sat down and looked at improvements we needed to our critical care units. Our intensive care and our coronary care units are very well staffed. We have wonderful people there, but we are getting out of date. And we drew up a plan 4 years ago, and I did not think this day was going to come. This day that we were going to actually look at implementing major changes for the sickest people in our community to allow us to do a better job. We currently have some people who are cared for in the emergency department waiting to get beds, waiting to get space. It's tough to get patients transferred. It's difficult for our staff, and it's difficult for families. And so this is a major improvement to help us take care of patients. I have a number of new specialists coming to our community who are going to practice critical care, pulmonary medicine, and if I bring them into a facility, that's out of date, that doesn't have the equipment and the resources that they need, they're not going to stay. I have to provide people with the proper setting for them to do their work to provide care for Cape Bretoners. So I think this is very exciting for my department, for critical care, that we're going to improve the way we manage patients in Cape Breton. And I am told that there's going to be serious investments in primary care, in chronic care, our chronic care facilities, so that people who are stuck in the hospital waiting for beds in the community, these beds are going to be developed. It is not a very comfortable place to be if you're not sick. And so people who aren't sick and shouldn't be in our hospitals should be in a proper care facility. And that's what I'm hearing this plan has today. So I am very excited about this investment in our community, this investment in our cancer center, this investment in healthcare that we're looking at. I think this is a great day in Cape Breton. I know Cape Breton is the most warm and welcoming place in the world, except when we are threatened. And when we are threatened, as you can see by a gathering today, we will stand together and fight against that. But I don't see this as a threat. I see this as an opportunity, as a growth, as an investment in our future. So, with that, I would like you to allow a few minutes for our Premier to say a few words. Stephen McNeil.
Thank you very much, Dr. McGonnell. Thank you. Thank you very much. As the doctor just laid out, this is an announcement about an integrated healthcare system, one that reflects the needs of communities today. We know that when the cancer facility was built in your area, it was built for 16,000 people a year. There are over 40,000 people going through that facility today. We have heard from healthcare providers, not just in our province, but across this country, that when they want to move to communities, they want to work in an integrated healthcare team, they want to work in new modern facilities, and they want to work in collaboration. That's what these announcements are about today, is how do we best ensure that when an emergency happens in your community, that you have certainty on which emergency rooms are opened, and to ensure those emergency rooms are equipped and staffed with what they should be as we go forward. We've continued to make these investments in an integrated system to respond to the needs of communities. Let me tell you, but I understand the anxiety for those of you in Northside and New Waterford. There's no question. There's anxiety in those communities. This is not about job loss. This is not about doing anything else than ensuring that we provide a modern healthcare system where we can have access into that system. In your communities where we're building new healthcare facilities, all of the things that you have today, you will have going forward, except emergency care will be required here at the regional, which we will make an investment in to expand it by 40%, and we will continue to expand that in Glace Bay. This is about providing an integrated healthcare system for the entire CBRM. It's been asked about when. We have Casey, which will be on staff, that'll be working today, promoting communities. I encourage all of you, as you absorb this information over the next number of days, to engage in the conversation about what those facilities continue to look like. We need to continue to make sure that as we make these investments, they reflect your wishes, at the same time reflects an integrated system that will allow us to attract healthcare workers across our province. This is a major investment in a modern integrated healthcare system. We're looking forward to continue to work with your communities and those who want to continue to modernize your healthcare facility to make sure it reflects the reality of today in your communities. I thank you for your passion. I thank you for being out today, and we look forward to continuing to work with all of you to make sure we implement these changes. Thank you all.